Hi, good evening, ladies and gentlemen, and welcome to our final Clinician's Choice webinar for 2020. It's hard to believe that in a few weeks we'll be celebrating Christmas, and when we look again, it will be 2021. So again, a warm welcome to Peter Alport, sitting in Canada. You all know by now, Peter's the international sales manager with a wealth of knowledge. And Peter, we really appreciate your time that you dedicate to doing these webinars for us in South Africa. And as you mentioned, this specific topic, provisional restorations, is one of your favorites. So without further ado, I'll hand over to Peter.
Thank you, Sharon. And again, good evening to everybody. We're ninth, all the mensen daar in South Africa. That's about the extent of my Afrikaans these days. Again, I appreciate the opportunity just to share with you some of our clinically proven solutions. And tonight we're going to be jumping into something that kind of gets overlooked many times, and that's provisional restoration. So I'm just going to switch here to my PowerPoint, and then we'll get going. Share screen. Share screen. Share. Bring up your PowerPoint. Okay. All right. Can everybody see that? Sharon, can you see that?
Thanks, Peter. We can see it.
Okay, perfect. All right. So I'm going to start by asking a question. What is the most overlooked, uninspected, easily delegated, most timely, and least checked procedure in the dental office? And it is the fabrication of provisional restorations. And the reason is it affects profitability more than any other procedure. And the reason is, folks, is time. Typically when you're doing your temporary restorations, you're not billing the patient separately. So we know when we're looking at temporary restorations, the two most important clinical considerations is, number one, we want to maintain the position of the tooth and or teeth. And number two is we want to maintain optimal tissue health. So we know the key to clinical success is the following, is we know, as I said, we typically are not charging the patient separately for their temporary restorations, unless you may be doing a full mouth rehabilitation. And so it probably makes sense that if you're going to be using materials that are fast, that are accurate, and then thirdly, are consistently and aesthetically appealing and look really good in the patient's oral cavity. Now, obviously, you don't want to make them too good because then the patient won't come back. So typically what I would recommend is that if you have those concerns, is do the temporary restoration in a different shade to the other teeth. Or bill the patient for half before they, half the amount before they do the procedure and the other half once they complete it. So there's really three simple steps to success when it comes to provisional restorations. Number one, which is probably the most important, and is really the foundation of creating an accurate provisional restoration, is selecting a quality matrix material. So the material to take that impression to make that temporary restoration. And there's a lot of options out there. So typically, probably the one that's most popularly used is alginate. The thing about alginate is, number one, your system has to get the powder out, the water, what temperature does the water have to be? You have to mix, mixed up in a bowl. The consistency of the mix might not always be the same. And typically we know that alginate impressions can take 1.5 minutes to 2 minutes to set. We know alginate, one set is not very dimensionally stable. And the challenge that you have with an alginate impression as well is, for some reason, if that temporary crown fails prematurely, you can't use that same impression to fabricate another crown. So typically you would have to try and freehand it or try cementing a polycarbonate crown. And this again is eating into to all your profitability. But one of the biggest challenges with alginate is it's not dimensionally very stable. And I'm going to kind of highlight this, and especially what is probably most critical, after I mentioned a couple of other options here. Number two, people use bite registration. Well, why? Because bite registration sets up really, really quickly. But the challenge with bite registration material is it's designed to be very rigid. So number one, it doesn't flow very well into all the anatomy. Sometimes if you have an undercut, the material has the ability to break. The big issue with bite registration, again, is the issue of these little interproximal tags. If you've got little interproximal tags, typically what most clinicians will do is they will cut those tags out. But then all you're doing is you're creating excess space for your temporary material, and you end up having to grind that away, which is just additional time and just additional money that you're wasting. People can use putty, but again, if you're using putty and you're wearing latex gloves, you probably have to remove those gloves, wash your hands first, because of the sulfur contamination in latex gloves can prevent putty from setting. Again, it's hand mixed. Long setting time, typically with putties, even if you add a little bit of additional catalyst to the formulation, again, putties are designed to be quite rigid, so they don't flow very, very well into all of the anatomy. Now, some people might choose to make a suck down. I have to say this is probably the most expensive way to make a temporary restoration, because first of all, you have to take an alginate impression, wait for that, then pour up a stone model, wait for that stone model to set. And we all know that the stone model will only be as accurate as the impression material you've used. And we know that alginate's not very accurate. So then you make the suck down. And what you can see here in this picture is how this material doesn't flow very well into the interproximal areas, and how we've got these, what we refer to as occlusal bubbles, if you will. So the common challenge, as I say, with all three of those materials is the issue of these little interproximal tags, which in something like alginate will tend to fold very easily because the material is not very dimensionally stable. But typically with a bite registration or a putty type material, people tend to cut them out. But this is what happens, is when you remove that impression from the mouth, you've got all this excess material that you now have to spend time removing. And that's not only the time, but this is all excess material, which is money that's just been wasted. Then, as I say, we have to spend time removing that. And then especially with alginate not being dimensionally stable, on occasion, you might have to make some occlusal adjustments as well. So when we look at some additional matrix options, typically if you've got a tooth that is severely broken down, many times you could use, say, a polycarbonate crown or a crown form. But the challenge with these is that sometimes you have an issue of fit. It either doesn't fit very well, it's too tight, or it's too loose, and you have to either adjust the inside of that crown. We know that especially crown forms, they are quite thick, so sometimes that can have issues with contacts. As I say, sometimes we have to reline these polycarbonate crowns with a bisacril type of material, or just a polymethyl methacrylate. And we all know with polymethyl methacrylates, they have a high exotherm, so they give off a lot of heat. So sometimes that can cause irritation to the soft tissue. Then the challenge with traditional polycarbonate crowns is the issue of shade. They typically only come in one shade. So, sometimes if you're doing a more aesthetic anterior case, it doesn't look that appealing for the patient when they've got, a polycarbonate crown that's maybe an A3 and their teeth are A1. So what do we recommend? Well, first of all, we don't recommend plastic trays. The challenge with anything that is plastic is it's elastic. So what we have is we have these little aluminum trays called the temp tray, which is our posterior tray, and then our anterior tray. These are made from a customizable aluminum. So these can be customized to the individual's arch size. We make them a perforated tray. The reason being is this helps to stabilize the matrix to prevent impression distortion. and then we make them with a higher sidewall so as to encompass the full length of the teeth if you will. And I'll demonstrate these under the little camera when we switch screens if you will. So what do we recommend using as our matrix material? We recommend our template. Template is the only material in the industry that has been specifically designed for use as a matrix material. So this is a vinyl material that is resin based. So what happens is it flows into all the anatomy to provide outstanding detail and accuracy. Additionally, it will flow into the tiniest morphologies, meaning that you have really minimal finishing time. You can see because of the accuracy of this material, there is so little excess, what we refer to as flash, and time that you would have to remove that. That is literally an onion skin, which you can break off very easily and then just take a little Softlex disc, polishing disc, or a little silicone polisher and just quickly smooth those surfaces up. Additionally, this material, once set, is 100% dimensionally stable. So even if you have an undercut, this material has the ability to jump the undercut, but will maintain the stable form indefinitely. Why? Because the elastic recovery of this material is 99.7%. So you can either keep this little impression in the patient's file, or you could give it to the patient as their emergency repair kit, meaning that if something happened to that temporary restoration, all they would need to do is bring that little impression back into them, and very quickly you would be able to fabricate them another temporary crown or bridge, if you will. This is what people like about this, folks. This material has a 30-second working time with a 30-second intraoral set time. So it is really fast. And this is what we want with temporization, because again, we know your biggest expense besides your staff and your building is time. So especially with temporization, if you're not billing the patient separately, we want something that we can reduce that treatment time so as to not affect your profitability too greatly. And then where we can also use this material as a lingual matrix. So in clinical situations, where a patient has, chipped an anterior central, maybe hit a golf ball, got hit in their mouth, or they bit down something hard. What you can do is you can make a lingual matrix first, and what that allows you to do allows you to very quickly determine actually the exact length of the restoration that you're building, and it will significantly minimize the finishing time on the lingual aspect of your restorations. Because if you have that matrix in place, when you cure that composite, there is no oxygen inhibited layer on the back of that restoration. So as a result, you will have to spend less time finishing and polishing a restoration. So there you can build your lingual shelf, and very quickly you can finish your restoration. Now, where it's also useful is for any of the folks that are doing cement retained implants. One of the challenges is when you're cementing that, all this excess cement sort of goes into the interdental papilla, and that can cause some potential periodontic concerns. So what we recommend you doing, if you're using a cement retained implant, is just to take some of this template and literally just squirt a little bit into that crown. As I say, it sets up in 30 seconds. You remove that, then you apply your cement into your crown, and then you push this die into that crown, and the excess cement comes out on the die, so that when you cement your crown, you don't have issues with any excess cement going into the soft tissue, if you will. Then the second step is selecting a quality aesthetic provisional material. Now, there's a lot of options out there. Typically, the ones that have been used up until fairly recently, I would say in probably the last 15 years, has been your polymethyl methacrylates. So something like Snap or Jet or Curd Tab would be some of the materials that come to mind, where you're using a monomer with a different shade of powder which you mix together. The challenge with these is, number one, they have a very, very high exotherm. So, they generated quite a bit of heat. So you got to kind of keep this, popping this on and off the patient's restoration so as to not cause significant discomfort for the patient. We know that they shrink very, very rapidly. So again, you don't want to leave it on the tooth for too long, because then you're going to have a struggle trying to remove the crown before you have to cement it. And then they tend to have not such a nice odor, which can be, a little bit, of course we want to try to do things that are as comfortable for the patient as possible. So, most folks now have switched to bicical formulations, and they work, for most part, they work very, very well. But here are some of the clinical challenges. Sometimes, your patient might come back because they've bit down on something hard, like maybe a piece of biltong or a hard candy, and the crown breaks prematurely. Or when your permanent restoration comes in from the lab, you find that you have to spend time adjusting the occlusion, and I'm going to tell you why that typically happens. Or you're spending 3, 4, 5 minutes polishing your temporary restorations, or the patient might say, this feels a little rough, feels a little rough to the tongue. When I run my tongue over this temporary, it feels a little rough. Or you'll have a patient come back and that temporary restoration has discolored. Or you might find that on occasion you're struggling to remove that excess temporary cement. And I'll tell you the reason why this happens is the challenge with traditional standalone bicical formulations is they are all very porous. So with it being porous, that's why they wear prematurely. That's why they stain prematurely. That's why they take a long time to polish. That's why it can be difficult to remove the excess temporary cement, because it sticks to that porous surface. So what do we do that's different with Inspire? We call it an aesthetic provisional composite, because what we did, it's the same bicical formulation, but all we did is we added a composite resin to the formulation. So the benefit of adding a composite resin is it eliminates those porosities and it makes the material a lot more dense. So when we were developing this material, we said, let's look at the market leaders in the industry and how do we compare? What are the most important physical properties we need to bear in mind when developing the material? So first of all, we wanted to have a material with a higher flexural and impact strength, so that if the patient bit down on something hard, there'd be less chance of that restoration failing prematurely. Then we wanted to have a material with a high E modulus. So what E modulus is, the higher the modulus is, the more rigid the material is. The lower the modulus, the more flexible the material is. Now we know that typically 80% of your restorative dentistry done is single unit. So if you have a material that doesn't have a higher enough modulus, the restoration will tend to wear prematurely, and the opposing tooth will super erupt to compensate for that wear, so that when your permanent crowns come in from the lab, the bite will be a little bit high, and this is why on occasion you might have to adjust the occlusion to get the bite right. Then we know that the challenge is also, is that if you have material that's too rigid, especially when you're doing multiple units, you're always going to have an issue with potential fracture the margin of the weakest point. So this is why we made our material with a higher diametral tensile strength. So by adding this resin to the formulation, it gives the material the ability to flex under load, because I'm sure you agree with me, teeth are like tires, they bend and they flex. So if you're using a very, very rigid material and you're using it for multiple teeth and there's no give, then there's a good chance that that restoration, you could get a little crack at the margin of the weakest point. So diametral strength is if you took a block of composite and along the same axis you subjected it to pulling forces. So it's almost like having a shock absorber in your motor vehicle. If you don't have a shock absorber, you're going to feel pretty much every bump in the road. Then it's also important that we make solutions that are a little bit more comfortable for the patient. So we made this with the lowest temperature rise and polymerization. So there's a little bit less of an exotherm. And then we made it with the lowest volumetric shrinkage. So there's two reasons why we did that. Is number one, we wanted to prevent tight fitting crowns, but B, especially on your longer anterior teeth, we wanted you to prevent from having short margins. Now, the benefit of this material is that if your margin is a little bit short, because it's composite, has a composite filler, you can add to it very easily with a flowable, just making sure that the restoration goes right up to the margin. So with this material, it has a very, very high fatigue limit, meaning that if the patient needs to wear the restoration for a number of months, they can do it with less chance of this restoration failing prematurely. And in terms of polishing, all you really need to do, and I'm going to demonstrate this to you, all you really need to do to polish your restorations is a very expensive polishing instrument called a cotton roll. You can literally buff this up. This was a 10-unit bridge that virtually required no polishing. All the clinician did is he took a cotton roll and just gently buffed those restorations. But you could see very quickly how I can bring that to a nice, natural-looking gloss, if you will. And then the third step is selecting a quality temporary cement. Now, we know some of the clinical challenges that can happen with temporary cements is sometimes the crown can come off prematurely, or when the patient presents for the final restoration, they've got irritated soft tissue, or this is the one that I hear most frequently, is when you remove the temporary crown, there's a little bit of a nasty odor. And especially if the patient's worn that temporary crown more than a couple of weeks, is sometimes when you remove that temporary crown, you have this dark black scuzz, this bacterial buildup under the temporary restoration. Then the challenge with most temporary cements is they are white in color. So especially on anterior restorations, sometimes, the more aesthetic anterior restorations, you can have the issue of show through. So when we look at the types of temporary cements that are typically used, the most popular would be your zinc oxide based, whether they contain eugenol or no eugenol, and probably the most popular one in the industry is a product called Tempond. Now, there's nothing bad about Tempond, it's just there's a limitation within the chemistry of the material. And any that is a standard zinc oxide based formulation is the challenge with standalone zinc oxides is they all leak like crazy. So what happens is the bacteria in the saliva, which is very acidic, will pass through that cement very quickly and create that septic environment, the nasty odor, the irritation to the soft tissue, and especially if the patient's wearing that crown a little bit longer, that bacterial buildup, that black scuzz, if you will. So what many dentists did as a compromise is they went to standalone resin-based cements, so something like Durolon or Tempon Clear. But the challenge with a standalone resin-based cement is they seal so well that many times when the patient presents for the permanent restoration, you either have to cut the crown off and then you have to then numb the patient up to go in with your ultrasonic to remove the residual temporary cement from the preparation site. So what we developed is we developed the only hybrid in the industry, a material called Cling 2. So what's unique about Cling 2, it's a resin optimized zinc oxide non-eugenol, but we added just a small amount of carboxyl resin to the formulation so as to optimize the adhesion, to prevent an excellent seal, and then also the reason why we add a little bit of that resin is to say to provide that seal to prevent any bacterial infusion so as to prevent the nasty odor or the irritated soft tissue, if you will, because as I alluded to earlier, the two most critical factors of temporization is number one, maintaining position of the tooth or teeth, and number two is maintaining optimal tissue health. Well, the other unique thing about Cling 2 is it's bacteriostatic. So when you remove the temporary crown, not only do you have optimal tissue health, but most of the cement is in the crown and not on the preparation site, which facilitates very easy and quick cleanup. You can literally take a little Explorer and just flick off the excess temporary cement. Now, with this material, you've got about 30 to 60 seconds of working time. It sets in 2 minutes, which is significantly faster than most of the other temporary cements. But after about 90 seconds, it gets to this gel phase, and you can just address the excess cement very easy with a little instrument. You'll notice it comes off nice and easily in large chunks. And again, you can, fabricate temporary restorations from start to finish using this system, if you will, in about 8 to 10 minutes. So here you can see on a more anterior aesthetic restoration, the material is not white in color, it's more tooth colored. So as I say, for these more anterior aesthetic cases, there's going to be less issue of show through. Now, when I show you this image, there's something wrong with this image, and the challenge is that the doctor in this image has used way too much cement. And the challenge if you use too much cement is you're always going to have an issue of trying to seat the restoration properly. So I'm going to share with you momentarily just a little technique tip that can A, reduce your cost, and B, you can be rest assured that it's going to be covering the entire surface of the preparation. So here we cemented in. As I say, after about 90 seconds, that excess comes off very, very easy, very, very cleanly, and there's your cemented in temporary restorations. So this is what we recommend you do, is that when you're placing the cement, just place it on the inside of the margin of the restoration. Because when you remove your temporary crown, you will notice that the cement has covered the entire surface of the preparation site. And look where most of the cement is, folks. Most of the cement is in the temporary restoration. It's not on the preparation site. So this is something we've just added very, very recently. We've added this to our portfolio about 2 weeks ago. So this will be coming to South Africa very shortly. This is a 25 ml cartridge. And just to give you an idea, here in North America, when we looked at the cost per milliliter compared to our 10 ml syringe is about almost $6 per milliliter more cost effective. So what we do is when you buy the 25 ml cartridge, we provide you with a mini dispensing gun at no charge. There's no additional cost to you for that. So let's look at a case, before we look at a clinical case, if a patient is going to be wearing this temporary restoration for more than a couple of weeks, what we recommend that you do is you apply some glaze, especially if you're using if you're using a traditional bicicle formulation we know is porous. The nice thing about the glaze, it's going to seal up all those porosities and just prevent premature wear and discoloration. Now, there are glazes and there are glazes. The challenge with most of the glazes in the industry is they are methacrylate based. The challenge with a standalone methacrylate based glaze is you can only use them extraorally. The challenge is if you get a methacrylate based glaze, if you're using it intraorally and you get on the soft tissue, you're probably going to have to get a step ladder out to get the patient off the ceiling because it can cause some irritation to the soft tissue. So the benefit of Glisten, it's a natural resin, meaning that you can use it intraorally as well as extraorally. Now, with this as well, being a natural resin, it is also not as viscous as a methacrylate-based glaze. So you literally need a drop on a little micro applicator, and very quickly you can apply it to the restoration. The cost per use is minimal. Typically out of a 5 ml bottle, you should get about 150 applications. So again, very, very inexpensive. Now, another nice clinical tip is if you're doing like an adjustment on a denture, to eliminate the roughness and the poor taste of the acrylic, you can literally just put a little drop on where you've done that adjustment, use a little micro applicator. Always recommend you wait about 15 seconds just for the solvent carrier to evaporate, because if you light cure it in less than 15 seconds, you'll find you'll see little white spots. So just wait about 15 seconds. But the benefit for your patient is that denture is nice and smooth and they don't have the nasty taste of the acrylic, if you will. And then these can be cured with any of the curing lights. So you don't have to have a specific curing light to cure this material. So what we've done is we're the only manufacturer in the industry that has created a little kit where you get just a little bit of everything just to get you going. So you get 4 anterior trays, you get 4 posterior trays, you get a cartridge of the template, you get a syringe of the Inspire in the A2 shade, and then you get a small syringe of Clink 2. You also have a laminated step-by-step technique guide that takes you through the steps, almost like a cookbook. And then under this here, we have all the relevant mixing tips. So just to take you through a case, and then I'm going to switch cameras, is here here's a tooth requiring a crown. So what we're going to do is first of all, we're going to take the impression with template. As I said, 30-second working time with a 30-second set time. Then we're going to go ahead and do our crown prep. Then we're going to load the Inspire into the template matrix. Now, with Inspire, you've got about a 40-second working time. The mouth removal time is about 1.5 to 2.5 minutes, depending if you're doing a single unit or you're doing multiple units. Now, the other added benefit of this material is that when you remove that from the mouth, you don't have to wait the full 4.5 minutes before you can start trimming the material. This material has a snap set, so as soon as you remove it from the mouth, you can start trimming it. It sets fully in about 4.5 minutes. So then you're going to place it in the mouth. Now, when you remove it, what you'll notice here, what I want to show you is because of the accuracy and the stability of the template, look how little excess material there is, how much little flash there is. And your biggest expense, folks, when you're making your temporary restorations, is the acrylic material, the bisacryl material you use to make those temporary crowns. So this is where template has significant advantages over the likes of a putty or an alginate or a bite registration material. Then we're going to cement the crown with the cling, remove the excess, and there's your temporary restoration. Now, if you say to me, yeah, that looks so good, the patient won't come back for the permanent restoration, that's when I recommend you do it in a different shade. But you want to maintain the form, you want to maintain the function, if you will. So on that note, I'm going to stop sharing and I'm going to just switch screens here. Oh, that's good. Okay. So where do I go now? This? Okay.
Okay, reshare.
Sorry, folks. I'm just going to go back in here.
Screen share. And bring up your camera.
Okay. And then here.
Yep, bring up your camera. Oh, no.
That's right. This one, yeah. Okay. So what I'm going to zoom in here a little bit. Oh, just bear with me a second. Just zoom out a little bit. Okay, so these are the little temp trays. As I said, this is the posterior tray. The nice thing about this tray is it can be used in any quadrant in the mouth. So, whether it's upper or lower, it can be used in any quadrant. Now, if you were doing, say, a second molar, you'd say, well, this is going to create some impingement. Well, all you do is you just simply fold that up and out of the way. And then that side, you want to fold it about a 45-degree angle to facilitate easy removal when you need to remove it. And then this is the little anterior tray. The nice thing about there is we put a little slot in the center, so for your lowers, you can make it a little narrower. And then for the upper arch, you can make it a little wider, and that just simply fits over there. Now, the other added benefit is if you've got a patient, say, that presents with lingual tori, you can just fold these little arms up. I mean, those little arms up, and now, as I say, if the patient's got lingual tori, very easily you can just place that tray in the mouth, so you wouldn't have to fabricate a custom tray. So this is, I'm just going to zoom out a little bit here. So this is the template material. So typically what you're going to do is when you hold the tray, when you're loading it, you don't want to do it from the top down. You always want to do it from the side, because this material is viscous enough that it's not going to run and slump. Now, I always recommend that you just put a little bit out on your glove, just to bleed a little bit off, and then just load the tray on the side like that, keeping the tip in the material so as not to incorporate any air. And then what we're going to do is we'll just simply pop that on there like that. Now, the reason why I just put a little bit on my glove is you can always just check to see when the material is completely set. Now, obviously, it will take a little bit longer because we're outside the mouth here, and typically the temperature in the mouth is about 37 Celsius, where room temperature is normally at 23 degrees Celsius. But this is what you will see when you remove it. What you'll notice is how accurate this material is. It's extremely accurate, whether you're using it in the posterior tray or in the anterior tray, if you will. So, how it really helps you is it prevents, as I say, you having all this excess material that you have to spend time removing. So this material is set. I'm just going to give it just a second longer, perhaps. But yeah, but there you can see. I'm going to zoom in a little bit here. I'm just going to show you just. You can see, look at that. I mean, all that anatomy, and this is the point that I want to make here, is even though you haven't gone in and done the crown prep, if I seat this back on the model, there's going to be no issue with those interproximal tags folding or you having to cut them out. Okay, so there you can see there's no this material, as I said, once set, is 100% dimensionally stable. And for the shelf life of this material, which is 2 years. So you could keep this in the patient file for up to 2 years, or as I say, you could give it to the patient as their patient repair kit. And people say to me, is this more expensive than LJ? Yeah, it is a little bit more expensive than LJ. But if you're spending 10 to 15 minutes, adjusting your temporary restorations, what is those 10 to 15 minutes worth to you in terms of time? There's a lot of value in using a material that's very, very accurate. Then in terms of the temporary material, that is, as I say, the Inspire, comes in 4 different shades, A1, A2, A3.5, and B1. Why didn't we do it in an A3? The reason why we did it in A3, we found that the difference between A2 and A3.5 was fairly close, that we didn't feel the need to have an additional shade. Now, as I said, with this material, because of that composite filler, this material is a very, very dense material. It's a very, very smooth material. So again, in terms of polishing, it is much, much easier. In terms of it being smoother to the patient's tongue, that makes a lot more sense. Because we put that composite filler in, it's in terms of flexural and impact strength, it's much, much higher. So it's not going to, and the higher E modulus, it's not going to wear prematurely. But what I'm going to do here, just to show you, is with the oil in my fingers, I'm just going to kind of remove any shine that I had here, and then just take in a very expensive polishing instrument called a cotton roll. Okay, I'm just going to literally just for a few seconds, just buff this up. And this is how long you're going to have to take to polish your temporary restorations, folks. It's just literally 5 to 10 seconds, as opposed to taking minutes just to... there you can see how quickly I can just polish those temps. And then in terms of the cling to, what I really just wanted to show you, this is our 10 ml syringe. We do make it in a 5 ml syringe, and I'll tell you why I would recommend the 10 ml syringe to you, or hopefully once we get these 25 ml cartridges out to you, that by far is the most cost-effective option. But the benefit of a 10 ml versus a 5 ml syringe is that, again, the cost per milliliter is significantly more cost effective. But what I just want to show you here is just that the material is not white in color, and we always want to just bleed a little bit off just to make sure that the material is thoroughly mixed. But I'm going to zoom in here a bit. And you can see that that material is not white in color, it's more tooth colored, if you will. And that is about as mean as I'm going to treat you. This is just a little glisten. As I say, this comes in a little 5 ml bottle. And, oopsie, let me just bear with me a second here. And as I say, typically out of a single bottle, you should get approximately 150 applications. So on that note, Sharon, if there's any questions, I'd be happy to answer them.
Peter, thank you. At this point in time, there are no questions posted. Let's see if any pop up. No, nothing for now.
Okay.
So thank you. Thanks, Peter. Thanks for a very detailed presentation. I did put in the chat group that there are special offers on all the products detailed tonight, and a full list will be emailed to all the delegates after the webinar. And again, Peter, thank you so much for your time and your dedication to the dentists in South Africa. It's been phenomenal the past few months. And I actually can't believe it's our last webinar for 2020. It feels a bit strange to say that.
It's it's my pleasure. I mean, being born and raised in South Africa, I feel very close to the country, and I still have family there and everything, and so yeah, anything to do to be of assistance to help elevate education is, because again, for folks that don't know our company very well, the philosophy of our company is teaching better dentistry. And for us to be able to teach better dentistry, we have to understand the common clinical challenges that clinicians face in their office every day. And armed with that knowledge, we have developed, referred to as solutions rather than products, because with everything in our portfolio, we have a means of differentiation. We have no desire to sell something that's identical to our competitors, because then it's just a matter of where you get the best deal. The one thing I did want to mention with Cling 2, I forgot, the temporary cement, is that if you are cementing to an all-composite core, that you use some sort of water-soluble separating medium to put on that preparation site, because otherwise you're going to probably have to cut the crown off. So just if you are cementing to an all-composite core, use something like a KY jelly, stuff you can buy from the drugstore, or I think Ultraend make a product called Deox, but don't use Vaseline, folks. The challenge with Vaseline, it contains petroleum, and that'll interfere with the setting of your temporary cements. Okay. Well, thank you for the opportunity. I appreciate it, and I wish you all well over the festive season, and hopefully, 2021 will be a much, much better year for all of us in terms of getting past this pandemic. And, hopefully I'll be able to travel down to South Africa to come out for the Congress next year. That's always a wonderful event for people that have been to that. I'm sure they'll kind of echo what I'm saying. Certainly from the level of education that is provided is outstanding, with very, very good speakers. On that note, wish you all very, very well, and we'll see you in 2021.
Thanks very much, Peter. So we've just gone on 7:45. I believe our president is addressing us again at 8 o'clock, so let's hope it's good news. So you've got 15 minutes to pour yourself a glass of wine and get in front of the television. So thanks again for participating this evening, and we'll keep you posted with regards to upcoming webinars. Thank you very much, and good night.